This is Dr. Srirang Abkari, consultant physician at Udai OMINI hospital. Today I will be talking something about diabetes. Diabetes is a disease which is increasing in magnitude severely, and in India the proportion of people with diabetes is very high. The recently conducted survey by the Indian Council of Medical Research shows that diabetes proportion is much higher than previously thought, both in urban and rural areas, and this presents a huge burden to treat diabetes, control its complications and have a healthy life. Diabetes predominantly is of two types, type 1 and type 2. In type 1 diabetes, there is absolute deficiency of insulin, which is a hormone which is required for your blood glucose control. The type 1 diabetic patients are generally young children who have absolute deficiency of insulin, and they need only insulin for treatment. If it is not controlled, the sugars level will rise very high and they go into a complication called diabetic ketoacidosis. So in addition to diet, they compulsorily require insulin, and in young children also, if we teach them how to take insulin and monitor the blood glucose levels, they can control insulin. Type 2 diabetes is what we commonly see in adult patients, wherein there is relative insulin deficiency and some amount of resistance to the hormone insulin. So initially they will have insulin resistance, but over a period of time, as the insulin deficiency also progresses, they may require insulin. To manage the diabetes, we need to first understand what are the problems associated with diabetes. So uncontrolled blood glucose levels affects actually all organs of the body. So you can have affection of the nerves, you can have affection of the blood vessels, you can have affection of the skin, kidneys, eyes, every organ can be affected. So it is not only the blood glucose level which is there, you have to take care of all organs. We generally describe them as microvascular and macrovascular complications depending on where they are actually getting affected. So strict blood glucose control is very essential. So somebody to diagnose as diabetes, if the fasting blood glucose level is more than 126, or a post-lunch blood glucose is more than 200, or a random blood glucose more than 200 with the symptoms of hyperglycemia, we diagnose them as diabetes. There is also a test called as glycosylated hemoglobin, which gives us the last 3 months average blood glucose level, which is useful for monitoring of the average control of diabetes in a person. So the essential treatment of diabetes initially begins with lifestyle management and diet. So we need a healthy diet for a diabetic patient, which predominantly consists of small frequent meals. So you have to avoid large amount of carbohydrates, especially complex carbohydrates, ready-made things which get absorbed very fast. You can have diets which are having complex carbohydrates so that the absorption is slow. Refined carbohydrates, if we take, the absorption being very fast, the blood glucose level can rise. So we tend to ask them to avoid rice or reduce the quantity of rice. They can have chapati, they can have jowar roti, they can have curries, they can have dal, and we encourage them to have at least a bowl of salad every day so that your blood glucose control levels is much easier. In addition to that, they must have a regular exercise regime, of course in consultation with a physician based on their health problems. When we come to the treatment with medications, there are two types of medications. Initially you have the oral anti-diabetic medications and then the insulin. Of course a lot of newer medications also have come down. The oral drugs act by various mechanisms, including improving insulin sensitivity or helping the pancreas to secrete more insulin or helping the insulin to act better, and we need to know which medicine is suited for a particular individual so that we can have a very good control of diabetes. Insulin, again, the moment we say insulin, a lot of people get scared that this is the final stage of diabetes, but even early on when somebody is diagnosed with diabetes and sugar is very high, we may give insulin initially to bring the sugar back to normal very fast and then again switch over to oral drug. There is nothing to be afraid of insulin because it, like any other thing, it is just a medication. The first time it may be difficult for you to just comprehend how you are going to take insulin, but once you start taking, it is a very easy process. We need to monitor the blood glucose levels. Devices called as glucometers are available. There are non-invasive methods also which are available now, wherein you can place a strip around your elbow here and just you take the meter or reader near there without touching it also, that will give a reading. Monitoring of blood glucose has become very easy. The important thing about diabetes treatment, that is, you should also be aware of something called as hypoglycemia. That is, if your blood glucose level falls below 70 milligram per deciliter, you get certain symptoms which is as a result of blood glucose going low. So that can be sweating, there can be hunger, there can be palpitation, there can be confusion, and if not treated and it falls below, you may fall unconscious. So once you know and recognize the symptoms of hypoglycemia, you should immediately take some you should immediately take some sugar containing food. It can be a chocolate, it can be a biscuit, it can be a sugar cube, etc. so that your blood glucose levels rapidly rise. Based on the patient's occupation, etc., the doctor will decide which of the anti-diabetic medication available for you is very much suited for you. And we also recommend annual eye checkup. Eye checkup is not only the number or glasses for a refractive power, but also a retina examination is important. Your foot examination should be done regularly. Avoid keeping feet very wet so that in between the toes you can have infection, cracks, etc. Before you go to bed, see your soles of the feet, and also make sure your blood cholesterol level, that is the bad cholesterol level, the triglyceride, is very much within your control. You may be prescribed certain medications in addition to diabetic medications like statins and antiplatelets or blood thinners so that you do not develop complications like heart attack or a stroke. Thank you.